Ebola danger. A physician who recently returned to New York from Ebola-ravaged West Africa has tested positive for the disease, officials announced. Craig Spencer, 33, a doctor who lives in the Harlem neighborhood of the city, was taken to hospital in New York on Thursday after displaying symptoms consistent with those caused by Ebola, including a fever of 103 Fahrenheit. A preliminary test confirmed that Spencer, who had been working in Guinea, has the virus. The Centers for Disease Control and Prevention will carry out a further test to confirm the result. The Centers for Disease has sent a team to New York City to assist city and state officials in the response. Officials say Spencer took a trip on the New York subway and took a taxi to a bowling alley in the Williamsburg area of Brooklyn in the past week, before he began to display symptoms. Health officials were working to trace the doctor's contacts. 4 people, including his fiancée and a taxi driver with the web-based Uber service, were being closely monitored. Spencer's apartment in Harlem was cordoned off, and health officials were giving out information to residents. His fiancée was being monitored in a separate quarantine ward at Bellevue Hospital. Leaders have attempted to reassure New Yorkers that the city and state are safe. City health officials repeated that Ebola is difficult to contract, since people must come into direct contact with body fluids of an infected and symptomatic person.